So now we are going to look at the branches of the internal carotid here. Okay, also while we're here, I want to mention the external jugulars, okay? So we're going to be following the arteries of the internal common carotids here that run parallel to the trachea. But remember, you have these brachiocephalic veins here, right, that branch into external jugular, subclavian, and common trunk of the costocervical vertebral. Right, so brachiocephalic, common trunk of costocervical vertebral, subclavian, and external jugular vein. Now see how the external jugular vein runs up the side of the neck and the side of the face? I'm going to show you on the other side a little bit better. Okay, so once you're on the side of the face, the external jugular comes up here, and this branch that goes up to like the edge of the mouth below the masseter muscle is called the anterior facial, and this branch that goes over towards the ear and the parotid gland behind the ear is posterior facial. Okay, and then if these were connected like this vein that connects the two parallel external jugulars across the trachea is transverse jugular. Okay, so you've got external jugular, transverse jugular, anterior facial going up to the edges of the mouth, and posterior facial go behind the masseter towards the ear for the veins. Okay, now for the carotid here, okay, we're going up the left internal carotid here. This first lateral branch is the muscular artery and vein. Then we have the cranial thyroid artery. The thyroid gland is usually right in here. It's be like a dark spongy tissue that's mostly been removed, but you might encounter that. So you have cranial thyroid and muscular. This is all common carotid coming up here. Cranial thyroid this side and muscular on this side. Okay, so your common carotid continues up, and then you have another branch. This is the laryngeal, right? Larynx, like the voice box. So remember we had the vocal cords right in here. So this is the laryngeal artery. So here we had cranial thyroid, and here we have the laryngeal. Okay. The next branch up is the lingual going to the tongue, right in the middle. Okay, so for the medial branches we have cranial thyroid, laryngeal, and lingual. Okay, going back up here, muscular on this side, and then we have two branches right here. This one is occipital, and then this guy, this little one here, is the internal common carotid. Okay, so we've got internal common carotid here, occipital, muscular, cranial thyroid, laryngeal, and lingual. So then we've got this little complex right in here. Okay, so and of those, this part right here, we had internal carotid and occipital. So, and this one's lingual. This one here is external maxillary artery. Okay, I actually have to look at these to confirm. Right, then this one is internal maxillary, and this short little section here is external carotid. Okay, so you had the lingual here. This is external carotid. Remember, this was internal carotid. So at this point, you know, the common carotid splits, right? You've got lingual, external maxillary, external carotid, internal carotid, and then this little branch right here is our posterior auricular. Okay, so auricle refers to ear, right? So this one's going back and down towards the ear. Okay, so posterior auricular, internal maxillary, external maxillary, right? And this is the like mandible here, so that helps you remember that. So posterior auricular, internal maxillary, external carotid, lingual, and then this is our common carotid with our internal carotid here, laryngeal there, occipital here, coming back down, muscular, and cranial thyroid. Okay. So y'all want to like quiz on that?